Thank you for coming. Hello, everyone. I'm Jonathan Lynch. I am the Deputy Associate Director for Communication with the Division of Environmental Health Science and Practice in the National Center for Environmental Health at the Centers for Disease Control and Prevention. I'd like to welcome you to today's EH Nexus webinar for Radon Awareness Week. All participants joining us today are in listen-only mode. Closed captions are available for this webinar. Next slide, please. Today's EH Nexus webinar will be available to view on demand a few days after the webinar. You can find the video recording of today's webinar at the CDC EH Nexus webpage. And next slide, please. You can see here from the logistics that if you have a question to ask, you can press the Q&A button and put your questions in there. We have a lot of content today, so we may not be able to get to all questions, but please ask them anyway. It's good information for our panel of experts. Next slide, please. Okay, I would now like to welcome our presenters for the webinar. We're pleased to have three presenters today. Dr. Salame-Alfie is a Senior Service Fellow in the Radiation Studies Section, Division of Environmental Health Science and Practice in the National Center for Environmental Health at CDC. Our second presenter is Dr. Thomas Golden. Dr. Golden is an Epidemic Intelligence Service Officer in the Office on Smoking and Health, also at CDC. And our final presenter is Dr. Bill Field. Dr. Field is a professor emeritus at the University of Iowa's College of Public Health with appointments in the Department of Occupational and Environmental Health and the Department of Epidemiology. Next slide, please. Before we go to our presenters, we're going to start with a video that illustrates why we should all take steps to reduce the amount of radon that we are exposed to.
My name is Jackie Nixon, and I'm 73 years old, and I am a cancer survivor. I always was one that was big on exercising, eating right, so my health was perfect. I never had the flu in my life. I got one cold, maybe a year. I couldn't ask for more. The indication that I noticed something wrong was when I was singing. And for example, if I sing a note and you have so many beats to hold that note, I would get like half of the way and I'd lose air. And later on, it became apparent that part of the reason was lung cancer. The first thought was, oh my God, I'm going to die. I did think about, things I might have done in the past that might have caused it, but bottom line is that I never smoked a day in my life. I had the surgery, and I was home for 7 months. Once I was able to go back out again, I went to a meeting, and there was a gentleman there, there was a home inspector. Did you ever hear of radon? I can't explain it to you, but for some reason, I immediately knew that was it. I took my own money and I got the highest level monitors, and I asked my neighbors, because you have to test at the lower levels. So we tested the building, and Rose's apartment came out to 18 picocuries. The government level, EPA level guideline is 4 picocuries. I said, well, I know what I can do. And I decided that I was going to start my own advocacy, just basically start telling people.
I think specifically in Jackie's case, she was diagnosed with lung cancer in 2015. And that was in a very rapidly changing era for radon and lung cancer. Had she been diagnosed in 2000, we would have never even thought of her case as radon related. And so the timing of the two, her diagnosis and the growth in knowledge, sort of coincided. And as time went by, in Jackie's case, as the years went by, she became like a healthcare hero. And she helped educate, people around her, the general public, but also me, because then I thought, wow, this is real.
Pay attention to your health, period. Do not ignore things. Radon affects your lungs. You may not have any symptoms, 0 symptoms. So test your house for radon and know your numbers.
Great, thank you. So now we're going to turn it over to Dr. Salame-Alfie. Dr. Salame-Alfie, please proceed.
Thank you, Jonathan. And boy, what a powerful video. Could you please put the next slide? Jackie mentioned quite a few things on her video. So what I'd like to do is cover some of the radon basics in my presentation. Next, please. And I want to get started with this little video, and then I'll go into more details.
Home is our place of rest, gathering, working, learning, and growing. We take care of our homes and the people inside them, and our homes protect us. But the Environmental Protection Agency estimates that 1 in 15 homes have high radon levels. Radon is a gas that you cannot see, smell, or taste. Radon is the second leading cause of lung cancer in the U.S. You can test your home for radon using a radon test kit. Call your state radon office for information on testing. There are many ways to reduce radon levels in your home if it is high. Call your state radon office for help. Test your home. Take action. Learn more.
Thank you. Can you please put the next slide? Okay, so we already started talking quite a bit about radon, and I want to break down into some important pieces. For example, what is radon? Radon is an odorless and invisible radioactive gas that comes naturally from rocks, soil, water. When you're in an outdoor environment, the levels of radon are very low and generally are not considered harmful. However, when radon gets into homes or buildings through small cracks or holes, it can build up to higher levels. And when we breathe in high radon levels over long periods of time, it can cause lung cancer. Radon is the second leading cause of lung cancer in the United States after smoking. Next, please. This graphic here illustrates how radon can get into the home. If you can see on the bottom, there's radon in groundwater. You move up is radon in bedrock, radon in soil, and you see the various pathways that can get into the home. For example, through construction joints, gaps around service pipes, cavities and cracks inside walls. If you have a sump pump in your home, a private well in some areas if they have high radon through the groundwater supplies, etc. Next, please. You may or may not be aware that 1 out of 15 homes has high radon levels according to data from the Environmental Protection Agency. Next, please. So how do you know if your home is high in radon levels? Well, the one way to know is to test. Like I said, you can't smell it, you can't taste it, you can't see it. But there is a way that you can test for it. You can contact your state radon office to get a test kit, or you can purchase it at a hardware store, or you can even get it online. Jackie, in her video, she mentioned picocuries per liter. That is the unit that is used to measure radon levels. And the EPA has an action level of 4 picocuries per liter. So if your test shows that the radon levels are above 4 picocuries per liter, or if you want to reduce the levels in your home, even if they're below 4, you can contact your state radon office and they will help you find a qualified or state certified radon contractor in your area that can fix your home. Because the good news is that high radon levels are fixable. However, it takes technical knowledge and special skills. So we really recommend that you rely on a qualified professional for these repairs. And once you do repair, we recommend that you test again to make sure that the repairs indeed reduce the radon levels. Next, please. Now, how do you know when to test your home? Well, certainly if it's never been tested or you don't know the levels, it's possible that whoever lived in the home before tested but did not provide you any results. So it's a good idea to test if you don't know the levels. A lot of people test when they're preparing to buy or sell a home. Also before or after doing any renovations, especially if you are making any repairs to reduce radon levels. Like I said in the previous slide, once you make a repair, you want to make sure that the levels have been reduced. And if you make any lifestyle changes in the home that would cause someone, for example, to spend more time in the basement, in a home office, or a playroom or whatever, if you have an unfinished basement and you finish it, you want to make sure you test to make sure the levels are still below the action level. Next, please. There's certain ways, certainly you can do it yourself. Like I mentioned before, you can purchase a radon test kit from a hardware store, from online. You can go and test your home or office, and then you can send the test kit to an approved laboratory, and they will send you the results on what your radon levels are. Next, please. Now, once you get your results, it can be either higher than 4, between 2 and 4, or lower than 2 picocuries per liter. And there are different things that you can do. If the levels are higher than 4, we'd recommend that if you use a short-term test, that you take a second test and do the average. You can contact a licensed professional to install a radon reduction system if the average of the two short-term tests is higher than 4 picocurie, or the results from any long-term are also higher than 4. Now, the long-term test is a test that you can place your detector anytime between 3 months to a year, and that will give you a more accurate description or depiction of the levels in your home. It is important that you retest a few months if you fix your home to make sure that the system is working properly. If the levels are between 2 and 4 picocuries per liter, we suggest considering installing a radon reduction system, and make sure you retest a few months after your home is fixed again to see if the levels were reduced. If the levels are less than 2, there's no action needed. You can test your home again if you change areas at your home, if you finish a basement, or you are in another part of the house that you weren't using before. Next, please. Now, when we talk about fixing your home, we talk about installing a radon mitigation system. Again, we suggest that you contact your state radon office, and there are radon programs in every state in the country. Or you can contact the EPA National Radon Proficiency Program, and they have listing of qualified professionals that can fix your home. Again, we highly recommend that you use people that are certified to do radon mitigation. And there are several methods. One that is proven to reduce radon levels is called a soil depressurization system. And that method uses a vent pipe that captures the radon gas coming from the ground and routes it outside the home. As you can see in this picture, there's a fan and it's venting out to the top of above the house. Next slide, please. There are other things that you can do to reduce your levels. You can seal the foundation cracks and other openings that also will help make this system more effective and cost efficient. And of course, different homes may need different designs. So it's very important that when you select a contractor, that they look at your home and give you a specific design for your house. And again, we suggest that you test your home after installing the system to make sure it works, and consider retesting every couple of years, or if you do any remodeling. Next, please. There are no known safe levels of radon, but even if your levels are not above 4, you can still take actions to keep the radon levels low. Of course, you can open windows and using fans. That approach works, but it's seasonal. There are many areas in the country that you cannot keep your windows open for more than a couple of months at a time. So it's a short-term strategy. Again, sealing cracks in floors and with plaster, caulk, or other materials. And again, if you do any of those things, make sure you retest. Next, please. Radon in schools. Like homes, schools can also have high radon levels. It's very important that you ask if your school has been tested for radon. If the school has not been tested, there are certified professional testing services or school personnel that can test the school for radon. But it's also very important that you contact your state radon program before doing any school testing, because some states have restrictions on who may conduct the test. Next, please. Now, did you know about the combination of radon and smoking? The risk of increasing lung cancer from radon and the risk of increasing lung cancer with radon and smoking is 10 times higher. So if you live in a home with high radon levels, if you're a smoker, it raises your risk by a factor of 10. Next, please. Now, the EPA, or Environmental Protection Agency, and the Surgeon General's office estimate that radon is responsible for approximately more than 21,000 lung cancer deaths each year in the US. The radioactive particles that are a product of the decay of radon gas, they can get trapped in your lungs. Of course, it takes many years for lung cancer to develop. And most people, like Jackie, you don't have any symptoms until lung cancer is advanced. And at that point, it may be much harder to treat. These are some of the reasons why it's important to take steps to reduce radon exposure throughout your life by testing and knowing your levels and fixing your home if you have elevated radon levels. Next, please. Some of the factors that increase your risk of getting lung cancer from radon include, again, living in or working in a building that has high radon levels, having high radon levels in the part of the home or building when you spend the most time smoking cigarettes, as I mentioned, currently or in the past, and also burning wood, coal, or other substances that add particle to the air. And currently, there's no conclusive data that show whether children are at a greater risk than adults from radon. Next, please. I want to just show you, we have a little calendar here. This week, we're kicking off Radon Awareness Week, and this seminar is actually the kickoff event. We will have different themes every day, and we will invite you to join our Radon Awareness Week by going onto our website, and I'll show you the link in the next slide. But Monday, we'll focus about getting the facts. That's today. Tomorrow, learning the risk. Wednesday, exploring data and resources. Thursday, keeping school safe. And Friday, talking to your patients. That's geared more towards the healthcare providers. We encourage you to check out our website and share with your family and friends. Next, please. And here's the link where we have additional information, where we have the video clips, when we have the testimonial, and some additional resources if you go to cdc.gov/radon. And thank you very much for your attention, and I'll turn this over to Dr. Golden. Next, please.
Good afternoon. Thank you so much, Adela, for that excellent presentation, providing us with some very useful and beneficial information about radon and about radon detection. As was mentioned at the outset of this presentation, or at the outset of this webinar, rather, my name is Dr. Thomas Golden. I'm an Epidemic Intelligence Service Officer at the U.S. Centers for Disease Control and Prevention. I work in the Office on Smoking and Health, where a lot of my research focuses on tobacco use and tobacco cessation, particularly in the clinical context as it pertains to primary care physicians. I'm a family doctor by training, and I'm very excited to talk to all of you today about radon and cigarette smoking. Could you please advance to the next slide? So the title of this talk is Radon and Cigarette Smoke Exposure, a Dangerous Combination. As was mentioned, I'm Dr. Golden. I'm an EIS officer at CDC, and I'm also a lieutenant commander in the United States Public Health Service. Please advance to the next slide. Thank you. Here we have just a brief overview of what we'll be discussing today. I'll start off with a talk about radon and smoking. And thanks to Adela's fine presentation, we already have a lot of background information on radon, what it is, where it comes from, and what the potential harmful effects of it can be. I'll delve into a little bit more detail about how smoking can potentiate and exacerbate some of those detrimental health effects. In the second part of my talk, I'll discuss secondhand smoke and how that is its own unique environmental health exposure, particularly as pertains lung cancer risk. And then finally, I'll close with things we can do tangibly to reduce our risk of lung cancer and other health risks posed by exposure to cigarette smoke. Please advance to the next slide. So again, to start, I'm going to discuss the additive effects of radon and smoking. Next slide, please. So lung cancer is the leading cause of cancer death in the United States. And the leading causes of lung cancer, as we've mentioned before throughout this session thus far, are number one, cigarette smoking and its attendant secondhand smoke exposure. And then the second most common cause of lung cancer after exposure to cigarette smoke is radon. And just to really drive this point home, smoking and radon exposure each increase the risk of lung cancer, and the combination of those two things increases that risk even more. They have an additive effect. Advance to the next slide, please. Thank you. Radon can cause lung cancer in anyone, regardless of whether or not that person used to smoke or currently smoked, as we saw in our introductory video. And again, studies have demonstrated a combined effect between smoking and radon for lung cancer risk. The National Cancer Institute estimates that around 90% of radon-related lung cancer deaths occur among people who smoke or used to smoke. So to kind of tease that out a little bit, while radon is an independent risk factor for lung cancer, it's even when combined with cigarette smoke, the risk of lung cancer increases even further. Next slide, please. Now we'll move on to the second part of this presentation, where I'll talk a little bit about another environmental exposure that can cause multiple health problems in addition to lung cancer. And that's something I'm sure many of us are familiar with, or at least have heard about, secondhand smoke. Next slide, please. To begin this section, I'll just define what exactly it is I mean when I say secondhand smoke. And put briefly, it's the combination of smoke created by smoking cigarettes. Smoke's created in two different ways via this mechanism. Side stream smoke, which comes from the burning end of a combustible tobacco product. Combustible tobacco products include many different things, but the most commonly used product in the United States and around the world is cigarettes. And secondhand smoke also constitutes mainstream smoke breathed out by the person who is smoking. Secondhand smoke contains more than 7,000 chemicals, hundreds of which are toxic, and 70 of which are known to cause cancer. Advance to the next slide, please. To kind of emphasize why this is so important, the U.S. Surgeon General has concluded that there is no safe level of secondhand smoke exposure. Secondhand smoke exposure alone can cause lung cancer. Results from a study from several years ago in 2014 that was conducted in Spain suggested that a combination of secondhand smoke, so among people who don't smoke themselves, but who are regularly exposed to secondhand smoke, the combination of that and radon does lead to an increased risk of lung cancer. So that additive effect of radon and smoking exists not just for those who smoke themselves, but for those who are regularly exposed to secondhand smoke. Next slide, please. So who's harmed by secondhand smoke? Really anyone who's exposed to it, even for a brief period of time. Secondhand smoke can cause health problems in children and adults, and it can even be deadly. Each year in the United States, secondhand smoke exposure contributes to approximately 400,000 deaths in infants and about 41,000 deaths among adults who do not themselves smoke. And since 1964, about 2.5 million people who don't smoke have died from health problems caused by secondhand smoke exposure. I think this slide is really helpful because in a systems-based approach, it's illustrative of all the myriad ways secondhand smoke exposure can negatively impact people's health. And I like how it's broken up into both children and adults. So among children, a lot of ear infections are actually correlated with secondhand smoke exposure. Secondhand smoke exposure can also cause respiratory problems, impaired lung function. Anyone who works in an inpatient clinical capacity would be able to attest to the degree to which secondhand smoke exposure causes asthma exacerbations in young children. And there is a correlation between secondhand smoke exposure and SIDS, or sudden infant death syndrome. And among adults, secondhand smoke exposure is correlated with stroke, with nasal irritation, of course, with lung cancer, the main focus of this discussion, but also coronary heart disease and low birth rate in pregnant women. Next slide, please. Now moving on to the final part of this presentation, I'll discuss tangible things we can do to reduce risk. Adela very comprehensively discussed some ways we can reduce the risk of our exposure to radon. And I'm going to focus a little bit more on ways we can reduce our risk of exposure to both secondhand smoke and smoke from combustible tobacco products. Next slide, please. So of course, the most important thing a person can do to lower his or her risk of lung cancer from smoking is quitting smoking. In my clinical practice, when I'm meeting with a patient who smokes, the first thing I always say when we're doing kind of an overall wellness visit or a preventive health check is that the most important thing you can do for your health is to stop smoking. Quitting smoking lowers the risk for lung cancer, obviously, but many other adverse health outcomes, including cardiovascular disease, other lung diseases that aren't cancer, and many other kinds of cancer, in fact. Quitting smoking is really hard. Anyone who's worked in a clinical practice or who has tried to quit smoking himself knows how hard it can be, but there are lots of resources that can help. Tobacco use disorder is a substance use disorder, and like other substance use disorders, there are evidence-based treatments to help with cessation. In fact, there are a number of FDA-approved evidence-based medications that can help with smoking cessation, and a conversation with a primary care physician can lead you to ways that might help using these medications as part of a comprehensive cessation plan. You can further reduce the risk of lung cancer posed to you and your family by testing and protecting your home from radon. Next slide, please. The only effective way to completely eliminate involuntary exposure to secondhand smoke is to eliminate smoking in all indoor areas. Continued efforts to promote implementation of statewide and local comprehensive smoke-free laws are critical to protect non-smokers from this preventable health hazard in the places where they live, work, and gather. The number of states that enacted statewide comprehensive smoke-free policies, such as no smoking allowed in work sites, restaurants, or bars, increased pretty dramatically from just one state in 2000 to 36 states in 2020. But despite this progress, 40% of the American population is not covered by these comprehensive laws. And while some states might not have statewide regulations, substantive progress has been made adopting comprehensive smoke-free laws at the local level. Smoke-free rules in cars and homes can also protect people, particularly the most vulnerable, such as children. Obviously, the change in that map on the left from 2000 to the map on the right in 2020 is encouraging, but we can clearly see there remains work to be done. Next slide, please. And I'll close with just what I hope are some key takeaways from this conversation. Smoking and radon exposure each increase the risk of lung cancer, as we touched on in that first section, and the combination of those two things increases the risk even more. Reducing radon exposure can reduce the risk of lung cancer in everyone, including those who currently, formerly, or never smoked. You can protect yourself and your family by quitting smoking and testing your home for radon. And secondhand smoke exposure increases the risk of lung cancer. Secondhand smoke, along with radon exposure, increases this risk even more. Next slide, please. Thank you very much for your time. I hope that you have found this presentation informative and interesting. And I will hand it off to Dr. Bill Field. Thank you again.
Okay, it's great to be with you, and enjoyed the first two presentations. Next slide, please. So what I want to talk for the remaining minutes that we have is about a new guide that we developed for healthcare providers to learn a bit about radon and to help provide guidance for their clinics and the patients that they see. Next slide, please. When we think about educating the public about radon, you can see in this graphic here, there's lots of different ways to help educate the public through health insurers, through building codes, through school officials, teachers, real estate agents. But one of the most persuasive ways to educate the public is through medical providers. Very often, medical providers are the only scientists that a member of the public will see, and they have a lot of trusted medical providers. So we thought this was a really important avenue to help educate the public. Next slide, please. So if you search radon and physicians over the past couple of years, put in those two terms, what pops up is a guide that the EPA developed many years ago, back in 1993. And when we did our focus groups for the healthcare providers, this was a guide that many of them were still using as reference information. So we thought it really needed to update it. Next slide. So through funding from the Council of Radiation Control Program Directors, these are the folks in all the different states that that promote the guidance for radiation exposure within their state, or usually at the different health departments. And they formed a group called Council of Radiation Control Program Directors, an excellent group. So they're the ones that funded the update of this guide, and it was really funding that they received from the US EPA. So it's really an update of funds that they have to develop an updated guide. And this guide was developed really through focus groups that I established, different parts, different regions of the United States, met with several times, developed the guide, went back and got feedback. And the input that we received was primarily from physicians, physician's assistant, nurse practitioners, and other members of the nursing staff. Next slide. One of the, and I want to talk rather than just, I'm going to be going over some of the content of the guide, but I really want to talk about some radon misperceptions that a lot of healthcare providers had, and I think members of the general public have as well. Providers often stated, as compared to the number of deaths caused by smoking, radon is really pretty insignificant. Why are we worrying about radon when we have, say, 140,000 people die each year from lung cancer related to smoking? And if you look at it from that perspective, pretty much all the other causes of cancer or cancer mortality look pretty small when you compare it to lung cancer. Here's colon and rectum's 53. So if you get down some of the other causes like esophageal or urinary bladder, why don't we worry about urinary bladder cancer? Look at all it's caused by lung and bronchus, or from cigarette smoking and the high rate of lung and bronchus. But I think it's the wrong comparison. If we look at the number of cancer deaths from radon-induced lung cancer, as mentioned before, it's about 21,000 each year, which if it was treated as its own disease category, it'd be one of the top 10 leading causes of cancer death in the United States. So if you look at it from that perspective, it's a really important cause of cancer death. Next slide. Another misperception is most of the healthcare providers thought that radon was caused from the radon gas, when it's actually caused by the radon decay products, inhalation of these radon decay products being deposited on the pulmonary epithelium, and then further decaying, producing genetic defects. Next slide, please. So as radon decays, it decays in a series of radioactive particles. These are solid particles that, when inhaled, get deposited in the lung. And two of them in particular, polonium-218 and 214, undergo further decay by alpha decay. And that causes a lot of radiogenic harm to the lung from these exposures. So it's really these radon decay products. And we want to really highlight that in the guide. Next slide, please. And as you can see, these alpha particles from these radon decay products, they cause double-strand DNA breaks, which can happen directly because these alpha particles they're very large. They impact a lot of energy over a short distance. Can really damage DNA. They can also produce free radical formation, and the free radicals can also damage the DNA and initiate the lung cancer. Next slide, please. Another perception was that mortality risk estimates for radon were based on old minor studies. And you heard the number 21,000. That was really the central estimate from an EPA document 20 or so years ago. And that was solely based on minor studies. Next slide, please. So these minor studies, as you can see here, were performed all over the world. So these are folks that work underground, hard rock mining, uranium mining, and they go in and they assess what the radon concentrations are, actually the decay products in these mines, and then they look at the adverse health outcomes related. So these were done all over the world, and these findings showed that as the radon exposure, radon decay product exposure increased, the lung cancer risk increased. So they interpolated, when I say they, the EPA interpolated this risk back to what someone would get in their home, and that's where the 21,000 came up with. So it wasn't an interpolation or an extrapolation from higher exposures. Next slide. But what we know now, and which a lot of the healthcare providers didn't know, that there were also direct studies done of people with lung cancer in their home. So we did a study, for example, in Iowa, where we identified people with lung cancer and we matched them to controls, and then we measured the radon in the house of people with lung cancer and compare that to the people without lung cancer to come up with risk estimates. So this is the sort of the technical summary of what the different studies have found. And when you, on the left column, it's all these different studies, European, North American, Chinese combined. So in North America, we had studies performed in the United States and Canada, and then Europe, there are numerous studies performed, and we pulled the data. So we took the original data from the studies and we did a reanalysis. And how you can interpret this, for the primary analysis for Europe, there's about an 8.4% increase. And then when I'm talking about increases, I'm talking about at 2.7, which is the World Health Organization guidance for radon. So these, we're seeing statistically significant increases below the EPA's action level. For North America, it was 11%, Chinese study 13.3%. And if you adjust it and use better exposure data where you have more a capture further back in a person's history, the risk estimates go up because you're getting less misclassification of exposure. But overall, you can see there's a statistically significant increase even at protracted exposures at 2.7 picocuries per liter. Next slide, please. The other focus group finding that we weren't too surprised about was that few providers received any training about risk posed by protracted radon decay product exposure. And they didn't see many chapters in textbooks or review articles on the subject. And in fact, a lot of healthcare providers coming out now, they don't get that much background on environmental causes of cancer in general. So we've really made an effort over the past 10 years to increase the number of publications and highlight these different environmental carcinogens in textbooks. Next slide, please. These are just a few that we were able to get published, and other colleagues are continuing to work on getting more information and getting this communicated to the different agencies and different universities that do training. The one in the bottom right-hand corner is Park's Occupational Lung Disorder book, and this is the primary text that's used to train pulmonary physicians. So we're getting more and more publications in the literature, getting more information for healthcare providers, but it's going to be an ongoing effort to try to increase information for providers. Next slide. So here's the guide. Here's the link to it. But if you just search EPA Radon and Health, the EPA has a link to it on their main Radon and Health webpage, so you can go there and really see it. So I'm going to just sort of describe some of the highlights of it right now. So next slide, please. So here's the different chapters we have. What is radon? Some basic information. How's it enter the home? Talk about radon decay products, the number and public health impact, the combined effect, smoking and radon. It's not just additive, it's synergistic. So it's not multiplicative effect, but it's more than additive. Radon health risk for individuals that have never smoked. There's about 20,000 people get lung cancer every year that's never smoked. The science behind the risk estimates, radon testing, radon reduction, sample guidance for healthcare settings, the role of healthcare providers in reducing the burden, and really importantly, educational resources. Where's the science to back up the information that we have in the document? And then interventions to reduce radon-related lung cancer. Next slide, please. So we have time for questions. I'm going to go through some of these a little bit faster, but I hope you have an opportunity to go and actually look at the guide. So we have updated information on there about how it gets in the home. Next slide, please. Updated table of risk, and I think a table like this, it's really kind of nice to look at the risk for never smokers, and the never smokers are someone that's never smoked 100 cigarettes in their lifetime. Current smokers, and you can see the increased risk for radon-induced lung cancer. If you look down to the bottom, the risk for living in a home for a long duration at the EP's action level is about 7 in 1,000, and for smokers it's about 62 in 1,000. And if you compare that to the risk that EPA sets their carcinogen standards at, more like 1 in 100,000, if we really treated radon like we treated the carcinogens that EPA regulates, we'd have to reduce outdoor air radon concentration. So it's a very significant environmental lung carcinogen. Next slide, please. One of the other items, one of the things that we noticed in the focus groups was physicians were very aware of the new lung cancer screening guidelines. So if you have a certain amount, if you're a certain age and you have a certain cumulative exposure to tobacco, you can get lung cancer screening, low-dose CT lung cancer screening, and it's covered by Medicare and most insurance agencies. The nice thing about this is that if someone calls in and they're not eligible for this screening, it's really a learning opportunity. It's a teachable moment where you can instruct people about other causes of lung cancer because they're already calling in, they're concerned about their risks. So here's an opportunity for them to really reach out and teach them, provide smoking cessation information, and then how to test for radon. Next slide. And I'm just going through these pretty quickly. They're on the guide, so I would really urge you. So we thought this section was very important, the science behind the risk estimates. Next slide. Radon testing, what's resources for how you do radon testing, how do you do radon reduction? Next slide. Sample guidance for use in healthcare settings. A lot of healthcare providers said this would really be helpful to them. What kind of guidance should we use? Next slide, please. And then one of the critical aspects, if we can get incorporated into healthcare settings, into intakes, when a patient comes in, how much are you smoking? Do you wear your seatbelt? Have you tested your home for radon, and then have information there if they haven't, where they can get either a free kit or a reduced price kit or access to that. But we've I think so far I've talked about 40 or 50 different practices that have used this, and it's been very successful. Next slide. And then providing educational resources. So we can, in the guide, we can only give summary information, but what was the scientific basis for what we put in the guide? So we have a lot of educational resources. Next slide. And then interventions to reduce the radon-related lung cancers, and just some different innovations that we think the healthcare providers can use, and they found that this was very helpful, this resource. Next slide. Availability of the guide at this link, but if you just type in breathingeasier.info, that's a good way to get access. But really, if you just go to if you search Radon Health EPA, there should be a link there as well. Next slide. So next steps are we're developing CME right now for the reading the healthcare providers guide, and we have a series of videos for healthcare providers at the Breathing Easier site that we hope to transfer over to begin offering CMEs for physicians as well as nurses. Next slide. So I went through them pretty quickly, but I thought it was important to leave time for questions. But this is the information that you can reach me, and feel free to reach out and contact me directly if you have questions. Hopefully this is just the beginning of our relationship about radon, and if I can be a resource for you or provide slides for any work that you're doing, please feel free to contact me. I'll turn it back to Jonathan for now. Thank you.
Thank you for that, Bill. So when we conduct these webinars, we acquire questions from multiple sources, and I encourage our viewers here for future EH Nexus webinars to send us questions in advance. Those are ones we can think through carefully, and we can give some priority to. And so we have questions both gathered in advance, and we have questions here as well. The first question, and some of these might revisit topics we covered a little bit, but it helps emphasize some of the important points that we've covered. What is EPA's action level for radon, and what does that phrase action level mean to the general public?
Adela, do you want to take that one?
Sure. The EPA action level is 4 picocuries per liter, and that is an action that's a level that's achievable with current technology. That was determined many years ago. In some instances, you can go much lower, but it is recognized that it's achievable to get down to 4 picocuries per liter. And I would just say the 4 is not 4 on the scale of 1 to 10. We've seen radon levels across the country in the hundreds and even thousands of picocuries per liter. The good news is that with the radon mitigation system, it can be reduced to less than 4 picocuries per liter. And I think that will be the take-home message. We even seen very complicated homes with very creative contractors that were able to reduce the levels to way below 4.
And the EPA notes that 4 doesn't mean it's a safe level, that they recommend taking action below 4 if you can do that. If it's below 2 and 4, they recommend retesting and taking action if you can.
That makes sense, and that's true of many toxins.
Right.
It's not as if they all of a sudden become harmless below a certain level.
Exactly.
That's right.
Jonathan, I'd like to just clarify. I think I probably was misunderstood. We don't have webinars every day. We will have outreach activities every day based on the topic. And if you go to our website, there will be different postings, and there will be Facebook postings and Twitter and things like that. But today is the only day that we have the webinar, and I apologize if that didn't come across correctly. Thank you.
Okay. Thank you for that clarification. I do have a quick follow-up question. If you know somebody who lives in an area that has, often is noted for having higher radon areas, if there are zones like that, how would you encourage them to really go out and get tested? Because I think sometimes it's hard to motivate people to want to take that action.
Well, I can say that based on experience working at a state that did a lot of radon testing, radon levels vary. Every home could be different. So it's very important that people test their home. How to encourage them, and how do you know if you're in a high risk area? Most states, I believe, in the EPA also has a map of radon levels based on actual measurements that have been done since the 1980s. The CDC has the environmental public health tracking data that also shows data, I believe, up to 2017, where radon levels are indicated. So that will give you a good indication of whether you're in a high risk or not so high risk. But each house is different, whether it's an old home or a new home, whether it's drafty or sealed. The only way to know if you have a problem is to test. And testing is very easy. It's relatively inexpensive. You can do a do-it-yourself home test kit and send it to the laboratory and get your results. When you get your results, you can call your state radon program and they'll help you interpret and help direct you if you need to do something to lower it. Just knowing that this is something that's certainly preventable, that you can do something to fix it, I think that, to me, that will be a good motivator.
What I always tell people is, think about it when you go to sell your home. You probably will have to test it. And when you test it, if you have high radon concentrations, you'll probably have to fix it. So why not test it now, take care of the problem so that you can benefit from the reduction in radon exposure that you have over time. Other people, it depends who you talk to. Other people are motivated by, it is a covered expense under flexible spending accounts. So that's a motivation for some people. Other people, they won't test for themselves, but they'll test for their children. So we've had a bunch of different pilot studies where we've given radon test kits in the newborn kit that goes home with the mother. So as I showed in that first map, I think there's a lot of different ways that you have to try to educate the public, but as we learned through COVID, sometimes it's not always fruitful.
And I would just add, a lot of states have free test kits available or very reduced costs. Again, the test kits are not expensive, but you can even get it cheaper or free through some state or county programs. So we suggest you contact, and there will be the resources will be on the slide. Contact the Conference of Radiation Control Program Directors to see the radon contact in your state, and they can direct you to whether there are any free test kits or low cost kits.
Great, thank you. That was really helpful. Going to follow up with going back to the questions that we gathered ahead of time. What is the average level of radon in homes in the U.S.?
It's about 1.3 picocurie per liter, and outdoors it's about 0.4 picocuries per liter.
And it's higher inside the home because of reduced, like it gathers in the home and doesn't necessarily evacuate.
Right. We used to say that radon is naturally occurring, and sort of changed that a while back. It's naturally occurring outdoors, but the way we build houses tends to trap radon. So it's sort of an enhanced type of radiation home. And we build homes that are not radon resistant in many cases. We don't build homes anymore that have lead paint. So we can start building homes that are radon resistant. And that's taking place in a lot of regions across the United States now.
So we have a number of environmental health practitioners and public health personnel who attend our webinars and who watch the recordings. And would it be advisable to consider promoting this kind of content to home builders? I assume that's a big part of the industry.
Definitely. And I should say that there is a national effort, that's the National Radon Action Plan. And we have been working to promote radon across all disciplines, across all communities. And that involves CDC, EPA, and HUD, along with a lot of associations that have an interest in radon. And we have been working together to develop some approaches that we can reach out as many people as possible and promote radon testing and mitigation. Certainly share the wealth, share the word with your other environmental health providers. And we have a lot of resources. The EPA has a lot of resources. HUD has a lot of resources. Other associations like ours, and I know I'm putting a lot of acronyms, they're available to, they have a lot of very valuable information, and they'll be happy to talk to you and help you promote radon.
Another good place are the cancer consortiums associated with the cancer plans, cancer centers around the country. That's another excellent resource.
I'm going to pivot off of that to respond to one of the questions that came in live, which asked if they will be able to share this webinar and will it be shared afterwards? And the answer is yes. We will do everything we need to get it ready and post the event on the EH Nexus website, and you'll be able to find it there in a few days. And then yes, please do share. Okay, I think we have time for one more question. So Bill, you talked a lot about what healthcare providers can do to help reduce the burden of radon-induced lung cancer. Can you emphasize some of what providers can do in terms of communications with their patients?
Right, and this is really important. So too often I'm seeing that the patients, the lung cancer patients, are the ones doing the education to their providers, and that's how they learn about it. But I think the first thing healthcare providers can do is test themselves. And it's interesting that healthcare providers have some of the highest testing rates. So they have to start out by modeling the behavior themselves. And once they model it, then they become familiar with how easy it is to do radon testing and how it's really not that difficult to do radon mitigation. And in most cases, it's not that expensive to do radon mitigation. It's typical to cost for a typical home repair on a home. But one of the things that they can do, and I'm very encouraged that we're seeing more and more physicians and staff, because they're really the first line people that see the patients, are including a question about radon on their intake information. That's a question they ask and they follow up with. So that's very encouraging. The other encouraging aspect would be I'm seeing now more low dose CT scanning centers. CT scanning centers are incorporating radon information when people call in, because you can imagine these are people that are concerned about their health. In most cases, they did smoke, so they're at higher risk. So I think that's some of the low hanging fruit that we have for reaching out to healthcare providers. But just getting them to test a lot of times gives them incentive to say, wow, this is so difficult, it's something that other people should do. And I cannot tell you how many calls I get each month from healthcare providers who they or their wives, discovered that they had lung cancer, never smoked, had high radon in their homes, and says, why don't we know about this? Well, it's not that we're not trying. So I think the videos like Adela showed, looking at actual lung cancer survivors. And one of the most important things to note real quickly is you can't tell if someone developed lung cancer from radon. You can, if they didn't smoke and they had a high radon, chances are it was radon. You can come up with a probability assessment. But it's the same can be said for smoking. When someone develops lung cancer and they smoked, it's just assumed it was smoking. There's no unique marker for radon-induced lung cancer or smoking-induced lung cancer. I think that's important to know.
Okay.
Jonathan, I just want to add quickly that the healthcare guide that Dr. Field mentioned is available on our website. Good. And it's also available in Spanish. So we encourage you to look at it.
Okay, thank you. And we are out of time. There were a number of questions that came in that might involve rather complex answers that are better answered with follow-up. And so I encourage everyone who asked a question, if you want a follow-up, please send an email to ehnexus@cdc.gov, and we can forward questions on to our panel of experts here. And with that, thank you, Dr. Salame-Alfie, Dr. Golden, and Dr. Field for providing our audience with this important information. And thank you everyone for joining us for today's EH Nexus webinar. If you have additional questions, you may email them again to ehnexus@cdc.gov. And that's it. Thank you, everyone.